It has been an extremely rich, successful Congress with almost 9,000 attendees and with several diverse innovative contributions both in the field of basic research and clinical research. To me, among the most interesting, the new treatments, particularly for the progressive phases of the disease, then the identification of prognostic biomarkers, the neurofilament light especially, that can be detected in the serum and can serve to guide the prognostic indications and treatment decision making in patients. Lastly, I would like to mention also the search on environmental and modifiable risk factors that we know, and we have a better understanding on those factors that can be modified and avoided in order to reduce both the risk of the disease and in some cases also to improve the outcomes of the disease. Cognitive decline is a frequent and debilitating symptom in multiple sclerosis that roughly regards 50% of the patients we visit in our clinics. There has been a lot of research, interdisciplinary research over the past 2 decades, and imaging studies have served to improve our understanding of the underlying changes, the lesions in the brain, of course, atrophy, and the involvement not only of white matter but also of gray matter. What we miss is a better understanding of the relationships between the structural changes and the functional outcome of the patient, so which are the compensatory mechanisms that are there and that can explain the great interindividual differences in the cognitive outcome. Another important field we have to focus on in the future years is the search for management strategies, effective management strategies. We have assisted over the past decades to clinical trials of symptomatic agents, pharmacological agents, that unfortunately have been mainly negative or conflicting. More promising are rehabilitation techniques, different approaches to cognitive rehabilitation that we have to develop in the future. Well, most of the patients, MS patients, are young females in fertile age, so the issue of pregnancy is really a critical one. We know several things about pregnancy. For instance, we know that women can be reassured. Multiple sclerosis is not a contraindication for pregnancy. It has it doesn't have any negative effect on the pregnancy outcome per se. Indeed, it is a protective period, the 9 months of pregnancy. There is a risk of increase of relapses after the delivery of the baby. But the issue nowadays is related with the use of disease-modifying drugs. So we have to look not only at the safety of the baby, but also at the safety of the mother. In fact, with some of these drugs, the discontinuation can produce a reactivation of the disease during the pregnancy in the mother. So it is extremely important to discuss with the woman from the beginning her desire of pregnancy in the short term, because this is a factor in the therapeutic choice, and it is extremely important to plan, to have a plan what to do before the pregnancy, during the pregnancy, after the pregnancy regarding the breastfeeding choice. And the last thing, it is extremely important to gather large data sets on the safety of the new drugs through registers and databases in order to be more informed about the effect of these drugs on the baby. In a word, the take-home message is hope. Hope because research is progressing a lot in all the fields, from prevention to treatment. So we are able nowadays to help people with MS to live their lives to the fullest, still having the disease.